Welcome back to HealthWise. With us again is Dr. Ty Hargroder with the Opelousas General Wound Care Treatment Center. Doc, we were talking about hyperbarics. Let's talk about a few other things that, the General has to offer.
Well, we make it sound easy, and you've seen the patients come in, we look at a wound, we say put this on it, do this to it, and it's fine and dandy. But there's a lot of things that go on behind the scenes with respect to that. A patient comes in with a wound to the lower extremity. Let's say that patient's a diabetic. Mm-hmm. That's all the information that we really have on this patient. There's a lot of things about wound care. Does that patient have adequate blood flow to the lower extremity? Because without adequate blood flow, it's not going to heal. And as soon as I can't rebuild large blood vessels with hyperbarics. We talked about rebuilding blood vessels, but it's the small blood vessels we rebuild, not the large ones. So if I have a diabetic who comes in and I suspect that they have blockage in their leg, I need to do some sort of testing. Well, the cardiopulmonary lab at Opelousas General Health System is probably one of the best cardiopulmonary labs around. They do a non-invasive study called an ultrasound with Dopplers that identify blockage in the large vessels of the legs, and then we can refer them to our cardiovascular colleagues, hopefully to put a stent. Sometimes physicians like Dr. Thibodeau need to do a bypass, although that's becoming not near as common since the cardiologists have gotten real good with stents. We need to refresh the blood flow to that leg. We need to improve it. All of this can be done right there at OGH. I mean, we can do the ultrasounds, we can identify the patients that need stents, and our cardiovascular revision. We have all of the specialists needed right there in Opelousas to do it, right there at the General. So, those things, and probably 99% of the diabetics who come in with a lower leg ulcer get a non-invasive scan or an ultrasound of the lower extremity through the cardiopulmonary department. If we suspect this patient has osteomyelitis or a bone infection underlying that ulcer, we need to know that because they may need surgery to debride that bone and take the infection out. They may need hyperbarics. Bone scans, a nuclear medicine test, or an MRI are the gold standards for diagnosing bone infections, done right there in Opelousas at OGH, also done at OGH's Diagnostic Center in Sunset. Again, right there, you don't have to go anywhere else for either of these tests. You can get them done, right there and treated. We treat all this right there at OGH.
I know one of the patients I know today had to go get a blood test, and I'm not sure why, but he told me, I think it was ordered by one of the doctors, that's something that he had to do. I guess y'all were checking to see if there was any infection in his blood.
Well, again, the General has always had a world-class lab, and we do a number of tests. They do a number of special tests for us that not a lot of centers do. Mm-hmm. One of those tests is a homocysteine level. Homocysteine is an amino acid that is elevated in patients who have a high inflammatory response to their body. There's certain medicines that reduce this level of homocysteine. We've seen that patients with high homocysteines typically don't do very well, and so we treat them to reduce the homocysteine. That test is available at OGH. It's done at the lab there. We don't have to send it off and wait 2 weeks for it to come back. Other tests, sed rates, something called a C-reactive protein are used to assess inflammation, predominantly in osteomyelitis or bone infections. Other tests, a prealbumin is a test that we do quite frequently, and it's a measure in the right clinical setting of whether a patient is malnourished. And you'll be amazed, I'm not a thin guy, I'm kind of heavy. But yet I could have a protein malnutrition because I eat too many carbohydrates and not enough protein. I don't eat proteins because I'm supposed to stay away from meat, which has fat in it.
And what is that going to do to you?
Well, the problem is wounds need protein. The body makes antibodies to fight infection. They're proteins. The body builds a collagen matrix and secretes things in there. It's all proteins. Enzymes are predominantly proteins. Right. We need proteins to heal. And so we can eat all of the carbohydrates we want, rice, spaghetti, bread. We need protein loads. And so frequently you'll see us say this patient has a protein malnutrition, they need to heal. We follow proteins, we follow blood counts. If you have a hematocrit, a blood count less than 30%, your odds of healing a wound are very reduced. Why? Oxygen carries blood. Now, I can put you in hyperbarics and I don't need red blood cells to carry oxygen with hyperbarics. But when I take you out of the chamber, that goes away. So you definitely at some point need to have your blood count. So we routinely look at blood counts. We routinely look at prealbumins. We routinely look at homocysteine, thyroid function. We frequently have to look at thyroid functions. If your thyroid is not working properly, you won't heal. I mean, there's just so much involved, which for myself, Dr. Thibodeau, Dr. Felton, the other doctors at the Wound Treatment Center, it's off the top of my head, order these tests. You know, but it's really complicated. All of that's done at OGH, right there. You know, don't have to go anywhere else.
Well, hey, that's why we love OGH. We're going to talk a little bit more about this when we come back with from this brief message from our sponsors.